So I want to thank everyone for, especially those people who came in a little extra early today to hear about the state of our department. So I think many of you know that our department, or the orthopedics at Duke, was started in a way by Alfred Chance, who then went on to become the head of orthopedics at DuPont out in Delaware. And when he started as the head of orthopedics, he was the only orthopedist in the department. And I think many of you have heard me talk already before about how our orthopedic department really has grown in size. It's really changed in the way we look, and it certainly has changed dramatically in the kinds of things that we've done over many years. And for those of you who are coming for our departmental picture, which is, Tiffany, when is that? Is it in 2 weeks? Or
next week, Wednesday.
Next week, Wednesday. So we're going to do something different this year. So besides having all of us in our picture, we're actually inviting our larger orthopedic family. So we're going to invite all the other people who work along with orthopedics. So we're going to take some extra pictures so we can get our larger enterprise of all of the employees who work in our department. And also, many of you know that several years ago, we went through a strategic planning process to transform orthopedics beyond cutting edge, and we're really continuing to follow on that plan to really build our department in the way that we want to evolve and grow in the future. And our vision is to be the global standard of excellence today and develop the leaders of tomorrow in orthopedics and rehabilitation research, education, and patient care. And really, it's all about our faculty. So the thing that makes this department unique and special is all the faculty who are in our department. And one of the most important things that we've been doing over the past couple of years is to really build and grow our faculty in a way that will maintain what's special about our department for the years to come. And over the past year, we've probably had our largest growth ever in terms of new faculty. So we've recruited 18 faculty in the past year who have been starting from August, who are either going to start between August 2016 to September 2017. I think this is probably our largest expansion of faculty ever. And I know that Richard Goldner likes to tell me that when he started here, the entire faculty could have fit on 2/3 of half of these. We were the six faculty members when he started, so it's a big change in terms of the size of our faculty and the scope of our faculty. And I'm not going to go through, because we have so many new faculty, I'm not going to go through each one individually. Many of these have been introduced to you in other forums, but we have brought up faculty from a variety of disparate areas. And I'm going to just mention a couple of faculty that have been starting, who either have started or are starting, who are bringing some unique programs into our department. So Steve George started about 8 months ago as our Vice Chair of Clinical Research and as the inaugural Head of Musculoskeletal Research for the Duke Clinical Research Institute. And most of our faculty in the research arena have been joint appointments. They've been joint recruits with orthopedics and another entity or another department. And he's our first one that's been a joint recruit with the Duke Clinical Research Institute. During his first 8 months, he's gone around and learned a lot about Duke, but he's already starting to build that enterprise in new ways, recruiting additional faculty, recruiting some clinicians to be part of that enterprise, and also bringing in some people who aren't directly part of orthopedics, but from outside the orthopedic arena to build musculoskeletal research. Shani Vargas is going to start this summer. Shani is a PhD researcher in engineering from the University of Southern California. For those of you who are here at our research day, she came to attend our research day, but she has a very large research program based on trying to build biomaterials that match different kinds of mechanical characteristics. So match the mechanical properties of cartilage, muscle, tendon, and then how those mechanical materials can change the way cells in them behave to really try and in a very different kind of a way, really tissue engineer new organs. And she has a very large program that she's going to be bringing here in September. She's bringing most of her lab with her, but not the giant rock bear. So that's going to stay in San Diego. So Gene Lewis, who is here I saw down the front row, is I think a really important new recruit because he's our first chiropractor on the staff at Duke, and this is really part of our concept of really trying to provide comprehensive care of all aspects for our patients. So not to really really pigeonhole into only a certain type of care that you can get when you come to see us for clinical care at Duke, but to be able to see the whole broad variety of care. And Gene, in addition to being a very experienced chiropractor, has also been a leader in the chiropractic community in North Carolina. He has a master's of public health, and he's done some work on area variation in chiropractic care, but also is really looking forward to doing some research on really some real clinical outcome studies on what kinds of patients are best to be managed through that kind of care, and what kind of treatments work best, and really to develop some novel kinds of multidisciplinary programs for spine care. Michael Guo has been recruited as a physiotherapist. He's a physiatrist, a PMR doctor, and he's a very experienced physiatrist who comes from Wake Forest, and as a very senior individual who's working both here on the Central Campus and out in Wake Campus, he's someone who is going to be playing a leadership role as we develop where our rehabilitation care from the physiatry standpoint is going to be moving in the future. Scott Reek is one of our graduates. He is a spine surgeon who is working in the far eastern reaches of our enterprise, and really has expanded our spine care a little bit further east than we had before. He's doing his surgery at Duke Raleigh Hospital, but has his clinic really he has some clinical care really very distributed around the Wake area. He's one of our graduates. He actually is about, I think what's interesting about him, he's about the same age as I am, but here's his picture from when he was a resident, when he graduated. Well, here are his pictures today, and it kind of looks the same. So I'm not sure how he managed to stay looking the same over all those years, but really looking forward to him help to develop our spine program as we move more into Wake County. And Colleen Wu, who's our newest PhD researcher, who joined the department earlier this year, I think about 4 or 5 months ago, is really working on the role of hypoxia in osteoblast, and really is going to sort of bring back an area of research that we had at Duke for many years about the role of avascular necrosis in bone and how that develops, and sort of bring that into sort of some modern molecular areas of research. Bill Juranic, who just started, I think this month, or earlier this month, came from Virginia Medical College, is really rounding out our arthroplasty service. And in addition to being a very senior leader in arthroplasty community nationally and internationally, he's also going to help to mentor many of our faculty and to help to develop our mentorship program, which is something that we have not really been as actively involved in the department as we probably should have been over the years to really develop that mentorship program better. And we're also welcoming back Jocelyn Wittstein and Tally Lassiter, who were one of our former faculty and a former resident who have been working in New York, who are going to come back to really spearhead the development of sports as part of our sports group, and focus primarily on how we can expand our sports enterprise in Wake County, and a focus also on bringing more of a teaching and research focus as we develop and expand into that area. We're also, our department's reaching out to put the patients and their families at the center of all we do to provide the highest quality care. And we have an exceptional group of clinicians. We have many of our clinicians who are routinely ranked as the top ranked physicians in North Carolina and nationally. And we've reorganized our clinical practice into a different kind of divisional structure. So these are our heads of our 6 clinical divisions. We have 2 other divisions. One is the doctoral physical therapy division, which is going to be undergoing some changes over next year to hopefully become more of a rehabilitation-focused division that Mike Landry heads. We also are going to be working on developing a formal research division. So we do have a research council, and the people on our research council are working on the structure that we'll use for a formal research division. But over our division heads, I really want to just give some special mention to 2 of them. To Bill Richardson, who's in this corner over here, who is the inaugural head of a combined spine division that crosses both orthopedics and neurosurgery. And we have a couple of our clinical areas that really cross more than one department. And rather than focusing on having each department work independently to push things forward, it's a better idea to see if we can get everyone to work together towards a common goal and to share resources, to share patients, and to share research and educational ideas to be able to move forward in a more integrated manner. And while there's some bumps ahead in trying to get two different departments to have a single division, I think he's already making some really important strides in moving forward to making a more integrated spine division. Dave Rouge is doing the same thing in hand. So hand care is shared between orthopedics and surgery through the plastic surgery division, and he's working on developing a single hand unit that integrates the hand surgeons from both of those departments. It probably has a little bit of an easier role than in spine, only because the group's a little bit smaller. So there's fewer individuals and fewer personalities who are involved in trying to organize that group. And they've had their first retreat already, and they've had a really good plan going forward for how they're going to build that integrated unit. Mike Bolognese is continuing as head of our arthroplasty group, which is growing it in size. Ned Amendola is continuing to grow the sports group, and those are our two larger divisions in the group, and depending on which kind of new faculty join, they're going neck and neck for which one will be the largest one in terms of faculty. Sam Adams in the bottom corner is the interim head of foot and ankle, as we're doing a search for a permanent head for that group. And Bob Fitch in the corner is the head of our division that's either called TOP or POT, depending on what you want to call it. It's the Pediatric Oncology and Trauma Group, which are those clinicians who work primarily here based at this hospital who don't fit into the other clinical areas. We also have a number of sections, institutes, and clinical leaders who are running our department. So Melissa Erickson and David Atarian are doing a really important job of overseeing the entire clinical enterprise. Melissa is our representative on the surgical exec and really organizes and manages what we're doing in the operating room. And David is, of course, our executive vice chair for clinical operations, and really is the glue that holds everything together. T Mormon is continuing his role as the head of the Sports Science Institute, which is our largest enterprise that's housed in a department that crosses multiple different clinical areas. And it's not just sports in orthopedics, but sports in cardiology, in neurology, in family medicine, in rehabilitation, in every aspect of care, and really is working to organize that and run that across all the enterprise. And they're continuing to grow and expand. They're thinking about expanding on the current Center for Living campus, as well as expanding their enterprise into Wake County. And then we have a number of sections. Steve Olson is running our hip preservation section. Greg Delarocca, our trauma section. We have Brian Brigman running our oncology section. And we have a new section that started this year run by Grant Galgris, and that's the shoulder section. And both the shoulder section and the hip preservation section also cross several of our divisions. So in both of those groups, they have people from adult reconstruction as well as in sports who are working on focusing on that area. And Anand Joshi is the head of our physiatry section. So we're continuing to increase what we're doing clinically. So in 2014, we saw 102,000 patients that year in our entire Duke Orthopedic enterprise. In the past fiscal year, which just ended, we saw 144,000 patients. So that's a pretty substantial increase in clinical activity in a few years. Some of this is because we have more physicians in the group, but some of this is also because we're seeing patients differently. So one of the major initiatives that we did to really help to increase the number of patients who come into our group is the development of same-day, next-day access. So if you come in, if you need to be seen that day, we have clinics that are run primarily by our physician assistants that run in the evenings every day of the week and on weekends. And Ray Malaguti and David Atarian and Mike Gagnon have really been influential in developing that system along the pathway. And we're continuing to expand that over time. We're also expanding into the Raleigh area as we continue to grow. That's where most of the population is in Wake County. And our efforts have really been to expand to that area. We've already done, we're probably ahead of most of the other departments at Duke in putting clinicians in that area, but we're also looking at doing that in a smart way, and also to bring in people who also are going to make connections to our academic mission in the department, involving having trainees there, medical students, DPT students, and residents, and we're working towards even having fellows go out to the educational area, as well as getting them involved in population-based research. It's also worked in a good collaboration with the health system. So we have a co-management agreement that initially started out just at this hospital that's expanding across the enterprise. And while I know it's co-management agreements to work between the health system and the clinicians, sometimes are a little bit slow going off. I can share with you that when we first started our co-management agreement here at Duke, after the first year I went to Kevin Sowers and I thought that this wasn't working. I didn't know if we should continue to do it because things were going so slow at the very beginning. But they take off better over time. They develop really good ways of communication back and forth. They've allowed us to have a single individual, Shilpa Shelton, who's now crosses all 3 hospitals to help to coordinate orthopedic care around the entire system. And over time, I think this co-management framework will develop with a better communication back and forth between the various parts of our enterprise and our clinicians to really have us drive forward and work more closely together as a clinical enterprise. We're also starting to come up with some innovative ways of providing care. So Chad Mather has been appointed our vice chair for clinical innovation, and we're looking at new ways to provide care, especially as we go into population-based management. How can we provide care for back pain and arthritis and other problems in a cost-effective way? What are the right kinds of physicians to see patients immediately, and how can they be triaged through the system in a way that's both provides the most cost-effective and efficient care and best for the patients and centered around that. And so he, along with others, are working on developing some demonstration projects to be able to identify how we can do this for care. And he's primarily going to be starting off with looking at joint pain as a way to start that off. We're also continuing to stepping up to serve and lead our local and global communities with integrity and compassion. And we have members of our department from the doctoral physical therapy program. Michael Landry is a good example of have spent a lot of time in Nepal and areas rebuilding rehabilitation programs. After the earthquake there, he's been recognized by the World Health Organization for the work that he's done there. But we also have other people from our group who are working to develop care in communities in South America, in Africa, and even communities here closer to home in some of the areas of the dorm community in which some of some of the students, especially high school students, might get less of an access to what might be available in terms of higher levels of education to really try and improve those, build those into our department. We're continuing to climb higher to inspire through innovations in basic science, clinical and translational research. And our goal of doing research is to generate and use new knowledge to improve orthopedic health worldwide. So it's really focused on things that are actually going to improve orthopedic health rather than just to be able to do research. And our research group is divided into research themes. We have cell genetics and developmental biology, musculoskeletal bioengineering and regeneration, movement science, kinesiology, clinical research, populations, policy, and implementation. And each of these groups is connected to a fundamental science group at the university. So for instance, the cell group is connected with cell biology. Bioengineering is connected with the engineering school. Movement science is built in with the doctoral physical therapy program. Clinical research, the Duke Clinical Research Institute. And populations, policy, and implementation with the Margolis Center. Now, people wonder, how can you measure whether or not any of this research is making a difference? Ultimately, what we want to see, or what we want to do, is we want to come up with research that's making a difference, that's improving the outcome for our patients. That's the long-term goal, but that takes a while. It doesn't happen overnight. So there are some surrogate ways you can measure that, and you can do that by things like grant funding. publications, and presentations that the department has. So this is our federal funding for this current year. I just had this pulled about a month ago. So these are all the people in our department who have federal funding. And while this is not the same as like our Department of Medicine, the amount of federal funding they have, we do have $2.8 million or close to $2.9 million in federal funding this year. We're getting very close to really what I see as like I think we should be slightly above $3 million in federal funding. And I think that's going to be coming up within the next year. But one of the other things that makes me really excited about this list is that there's a lot of people on here because when I first got here, there were only 3 people who had federal funding in our department, and now we have quite a larger number of people with federal funding. We also have a lot of people with non-federal funding, and this list is even, I think, is even a little bit, it's even a bit more exciting because there's a very large number of people in our department who have some kind of non-federal funding. Altogether, we have $2.4 million this year in non-federal funding, and a large portion of our faculty, about over a third of them, have some kind of research funding, which I think is a pretty exciting achievement for our group. So our total research funding this past year was $5.3 million, close to $5.3 million. And if you want to see how that compares, people said, well, it just looks like a big number because I came here and I brought my research program with me. So I pulled out the numbers that actually Mike Gagnon had pulled for me when I first gave this talk back in 2014. So I already had my funding here. And back then, the entire department, federal and non-federal funding, was $3.6 million. So that's actually a 50% increase in just a few years in our total research funding. How about publications? So we're continuing to publish our work in a whole variety of journals, and this year we've reached a new record of 186 different publications. I'll get to this in a moment, but 71 of those publications really came from our doctoral physical therapy faculty. So part of our growth has been by incorporating the doctoral physical therapy program into our group, but this includes publications. In this year we've had a publication from our faculty in Nature and a publication from our faculty in New England Journal of Medicine. So we're really also publishing in some of the highest impact papers. And there's been, at least on the CVs that I got so far for the end of the year evaluations, we counted 243 lectures that were given around the world. And I just pulled out several of the named lectures that were given. And it's common for a senior faculty to give some named lectures, but I'm pretty excited that we have some of our junior faculty, like Will Eward, who's also going out and starting to get some named lectures. And this really shows how shows the high regard in which people really hold our faculty members. How about in education? So our largest aspect in education really in the department now is our doctoral physical therapy program. And probably the biggest change in doctoral physical therapy program over the last year has been their really stellar climb in national rankings. So it's now ranked as number 10 in physical therapy programs in the country by U.S. News & World Report, and that's a major jump from the mid-20s where it was ranked before. And that's really been really the efforts of Mike Landry and Chad Cook and his group and how they sort of have re-envisioned that program. There's a number of scholarships that are given out each year, and the number of scholarships has actually increased. And these are some of the doctoral physical therapy students who have really gone on, who've done really well in school and are going on to hopefully a great stellar careers going forward. The Helen Kaiser Scholarship is named after the first head of the doctoral physical therapy program. The Student Recognition Award and the Diversity Awards are also given for students who came. The Student Diversity Award is for someone who came from a diverse background, and it's actually a subset of the Helen Kaiser scholarships. And the Student Recognition Award is given for a student who's really done stellar work throughout their program. The Doctoral Physical Therapy program is soon coming up to their 75th anniversary. They're planning a really nice celebration for that we'll all be hopefully invited to. They're planning on adding an occupational therapy group to a degree to their program. They've had 71 publications this past year, and that's up 19% from the year before. So even though that's helped us as a department, the total number of publications as they're growing on their own. They're improving their diversity in their program. They've really developed this really nice summer discovery program to take people from disadvantaged backgrounds and have them discover what physical therapy and what college is really all about. Their faculty is continuing to grow, and they're starting to make really strong connections with the orthopedic group. So our having Steve George as our head of clinical research from a physical therapy background is helping with that. We're starting to look at some combined postdocs and some other faculty that are connecting together. And as we work towards our new home in a new building, they're already starting to increase the size of the doctoral physical therapy program. Brian Brigman and Fraser Lever says are continuing to work forward on helping with the educational program for the orthopedic department. They do meet every Wednesday before our grand rounds at 6 a.m. I meet with them, but I show up at around 6:15, a little bit late to talk with them. And they've continued to really push forward in a variety of areas. And they're focusing on issues such as time constraints for our trainees. How do we know we're really competent? And how do we do education in an era when everyone does a fellowship? And we're also working a bit on whether or not we can shorten training over the entire continuum. So if you look at the Duke curriculum, it includes this scholarly experience for 1 year in the third year of medical school. And we've looked at if we can use that scholarly experience in a different way to be able to develop a program in which we can shorten the formal medical school part of the education to 3 years, have people go earlier into the internship training, and develop a comprehensive program over the continuum that involves both the medical school training as well as the residency training, taking a year off the entire duration of training. And we've started the second year of having students into that pilot program. We also need to focus on what's needed for today's orthopedists. Almost every orthopedic resident does a fellowship. We did a poll at the AOA a few years back. Actually, Ned Amendola and I did that poll. And all but one of the residents who were polled were doing fellowships. So everyone's becoming a specialist. And the question is, in an era when everyone becomes a specialist, what's the role of the general residency? What's the role of the training? So if you're going to become a spine surgeon, why do you need to learn about an ACL? And it's something that really is a change in how we think about education. And so we have a new curriculum that we're slowly implementing at Duke to look at what's needed for today's orthopedist. It has two phases: a general core phase to teach like what a spine surgeon really needs to know about hand surgery on those rotations. So we're slowly getting to focus on evidence-based educational principles, not just having residents spend time with a faculty, but learn the things that they need to learn to become a competent orthopedist, and then having the last couple of years trained on their eventual practice, more focused training if you're going to become a spine surgeon for what you need to know. These are our current graduating residents. They're all going on to really high-quality fellowships. But again, they're all going on to fellowships. Dr. Morwood seems to be going on to 2 fellowships. But the remainder of the program are going to really the top quality fellowship programs in spine, adult reconstruction, trauma, and orthopedic oncology, really the top programs in the world. And we have a new set of residents who are coming to take their places, who are really also, I think, are going to be incredible additions to our program. And although we always do have a number of people who come from Duke. I'm not sure exactly why, but we have 2 from Mount Sinai in New York next year, so I'm not sure where that Mount Sinai connection came from. But we won't hold them coming from New York too much against them. Our faculty have won a number of awards over the past year. Jeff Batowski won the Golden Apple Award for teaching. Steve George was selected as a recipient for the Physical Therapy Award for impact on practice. Jim Urbanek was featured as a legendary leader at the 85th anniversary of the celebration of the PDC for his work on microvascular surgery. Melissa Erickson was named as one of the top 35 female spine surgeons to know. Sam Adams and Will Eward were selected as Duke Health Scholars, and this is a really major accomplishment because this was an open competition across the university for funding for clinician researchers clinician scientists who have the ability to make major advances in science. And this was open to the entire university. We're competing with people from the Department of Medicine. I always remind people the Department of Medicine has a Nobel laureate in it. We don't quite have one yet in orthopedics. So for Sam and Will to be able to get these awards is really a really remarkable achievement. Courtney Connors, one of our new research faculty, won the Young Investigator Award for the ASBMR meeting. Grant Garagous was selected as a shoulder and elbow traveling fellow. Nan Joshi and Chad Mathers received port grants to help with identifying how we can use clinical data in knee pain and spine pain. Amy McNulty received the first place at the ORS Award. John Rebo received a Strong Start funding, also an award from the medical school. And this is for people just starting out their research careers to be able to give them a strong start to develop their careers as clinician scientists. And I believe, I may be wrong because I didn't actually see the list, but I believe he's the only surgeon to have been able to get a Strong Start award. So that's a big achievement for him because the other people were from the medical field. So congratulations to Jonathan for that. Will Eward received a Hyundai Hope on Wheels Award for $250,000. Thorsten Seiler received the very first inaugural Foundation for Arthroplasty Research grant. And David Atarian received the 2017 Professionalism and Excellence Award. So these are some pretty impressive achievements from our faculty. We also this year started a new tradition. We gave out Master Orthopedist Awards. These are for faculty who have made major contributions to orthopedics over the years. And our first two recipients, this year we're going to give one out every year after this, but the first year we gave out 2 awards, one to Jim Urbanek and one to Ralph Coonrad. We've had a number of other faculty who have played leadership roles in various societies. Ned is the president of the American Orthopedic Society for North America. Fraser is a council member on the American Society of Surgery for Hand. Sam Wellman is playing a leadership role in AUKUS as well as on the National Advisory Board for the VA. David Roosh has played a number of roles in the AOA and the Hand Society. Steve Olson was a past president of the Trauma Association. And Bill Garrett has a number of awards he's received in leadership roles in soccer as well as the Herodotus Society. We've also, Erica Taylor has been named the chair of a revamped diversity inclusion committee in our department and has identified a number of new initiatives to help build us build a stronger diversity and inclusion program in our department. And in addition to the members of our department who are faculty, we also have a large number of people who work along with us in our central administration and the clinical aspects, both in the ORs, in the clinics, and who help to keep our department running. And we've actually well over 300 people who work in those areas. And I don't have all of them to recognize, but Tiffany, who does our communications, has pulled from our blog a number of mentions of some of our staff who have been mentioned in our blog. So this is a little plug. If you have things you want to put in our blog, send them to Tiffany. We'll put them on our blog. And next year I can show you at our State of the Union or State of the Department. I can talk about them a little bit. But we have several of our members who volunteered for the Duke Children's Radio Marathon. We've also had several of our advanced practice providers who play a role during the Special Olympics at Carey Academy. This is something that Ray Malaguti started to build coverage for years ago. Michael Gagnon and John Bonini play leadership roles in the Academic Orthopedic Consortium. They both gave talks at the meeting last year in Southeast Florida. Michael Gagnon was actually the founder of that group. Our trauma clinic has been recognized for the excellent patient scores they've received over the years. Sarah Bird was inducted into the Emory Sports Hall of Fame. She's one of our nurse practitioners in the Spine Center. And Peter Pavlis had his photograph that he submitted to Duke Time Off, featured in Duke Today, that he took when he was driving along the Blue Ridge Parkway near Asheville. I just wanted to make a mention about our electronic media. So we do have our We do have all of our grand rounds available on YouTube, and Tiffany's done a really nice job of really putting a blog, keeping things that are going on, keep a blog, keeping us up to date on what's going on. So I really would encourage you to put things that you want to put on our blog into there and to keep track of what's going on by looking at our website. So just want to talk just a little briefly at the end, just a little bit about some of the things that are going on in our future. So we're going to continue to do clinical expansion as we move into Wake, but we're actually already, compared to I think many of the clinical departments, the clinical groups at Duke, we're actually a long way there already. So as we continue to do that, I think we're going to continue to do that in a smart way to be able to capture a good proportion of the population that's moving into the Wake areas. That's where most of the people in the Triangle are living. We're going to really be working on innovation in care delivery. I think there's going to be a lot of changes coming down the way in the way care is funded. There's already been some changes that probably are already happening from CMS, and the way care is going to be delivered and how we're going to be paid for care might be changing, and even how insurance companies work are probably going to be changing over time. So we need to really be thinking about innovative ways to do care delivery. We're continuing to flip the educational model. So our medical school has a flipped classroom, where you do your reading mostly outside the classroom and you do discussion inside the classroom, and that's the most effective way to learn. And we're continuing to work on flipping that educational model both in the DPT program as well as in our residency as we go forward to really make our educational programs more effective and efficient. Chad, Bolo, and Steve George are working on implementing our clinical data mark, which I'm told will be up and running within 6 months. Is that right? Yes, Chad says yes, 6 months. So we'll finally be able to have a system-wide approach to be able to collect clinical data on all of our patients. This is going to be used both for clinical care as well as for research to be able to do that. We're working on integrating clinical and research activities, and a clinical data mart is one example of a way to be able to do that. We're continuing to work on integrating osteoarthritis research across the department, and DCORT, which is the Duke Center for Osteoarthritis Research Translation, is really working to be able to work on that. We're working on the evolution of our administration. Our department has almost doubled in size, and the way we did things in the past from an administration standpoint needs to change as we go forward. So we also need, just like we need to look at providing more efficient and effective patient care, we also need to work on providing more efficient and effective administration. And over the next year or several, I think we need to translate ourselves to more of a team-based approach. We've done a very good job of really focusing on individual accomplishments for our faculty. And as we go forward, we need to think much more about what we can accomplish as a team. What can the sports group do as a team? What can the spine group do as a team? What can the pediatric group do as a team? What can the oncology group do as a team? Probably one of our most important things going forward is going to be our new building. That's this white building here in the middle next to the nursing school. And we're hopefully still on track to be able to move into this in about 2.5 years, you think? Yes, about 2.5 years. And our orthopedic offices will be up on the top floors, and the new doctoral physical therapy educational programs will be on the bottom floors. And as we look at what we're doing with arthritis, you know, today, osteoarthritis is a progressive disease. Everyone gets it as you get older, and we're working as a group in terms of how we can tackle that problems by, can you come up with biological rehabilitation approaches to slow the progression? Can you rebuild damaged joints in a biologic way? Can you target the treatment of some of the side effects, the depression and pain associated with it? And can you have more cost-effective ways that we can use what's currently available to come up with better treatment? So working together as a group on that to be able to see if we can stop the progression all the way, or if you do get it, rather than having to do arthroplasty kind of treatments, if instead you can have some kind of a pharmacologic or an injection or biologic approach to make that better. Now, I just want to show this picture, not because of me or Coach K, but the other thing that I think we need to work on a little bit is about how we really are connecting with our community and our local and the other orthopedists around. So the other person in this picture is Tom Dimig, who was when it was Triangle Orthopaedics, he was sort of the head of Triangle Orthopaedics, now Emerge Orthopaedics. And I think we really need to start to look at ways that we can really interact with the other orthopedists in our community in sort of novel ways and things that we can do together to really help with things, fundraising, philanthropy, other kind of things, to really get together and work a little bit differently as a group going forward. Now, I'm going to, I know I'm a few minutes late, but I'm going to end with just talking a little bit about change. So this is Leonard Goldner. Leonard Goldner actually took over as head of orthopedics at Duke 50 years ago this year. So some 50 years. And I think a lot of people are concerned, some people are concerned with the change of pace that's happening in our department. So there's been a lot of changes in the past few years, and they're worried about where change is going. But I want you to think a little bit about what would have happened if nothing changed in 50 years, and think about how much different everything about what we do is, how everything is different than it was 50 years ago. The size of the department, the look of the department, the kinds of things we do. Remember, 50 years, there are no computers. There's computers in every room. No image-guided treatments for things. Surgeries were done very differently. Instrumentations were doing differently. Arthroplasty wasn't really done in the way we're doing it today back then. Arthroscopy didn't exist. There were open procedures that were done for what's going on. Those change came from people being innovative, people doing research, people pushing the envelope, and people doing things differently. We live in an era where change happens faster. Communication happens instantly. 50 years ago, if you did something new you couldn't read about until it was published in an article, or if you did traveling fellowship and you ran into somebody, you happened to run into someone in a meeting. Today you do something new and different, it's on Twitter, and everyone knows about it in about 5 seconds. So the pace of change is really happening very quickly in the world, and organizations and groups that can keep up and change faster in the environment are the ones that become successful. Those that can't change and aren't willing to change really wind up slowly petering down over time. So I think it's really important for all institutions and all groups to really be set up in a way that you can be able to be changing in a smart way. If you make a change that doesn't work, drop it. And many of you know we've made some changes here that didn't work, so we dropped some of the changes that go the wrong way. But to be willing to be able to change faster than the environment around you so you can succeed and grow. And there's many examples of that in the world about those organizations that were rapid to change, grew and prospered. People who didn't want to change, didn't want to make differences, slowly peter out in time. Just think about the Sears department stores as compared to Amazon. Is a difference about the same exact business but doing it in different kinds of ways, how quickly and rapidly people are willing to change. So I think it's really important as we go forward that we need to be able to use that change in a smart way for us to continue to develop, so we're not spending too much time thinking about how things used to be, but instead taking those strong traditions and building on them to really make them better as we go forward. And finally, I want to go back to our faculty. So it really comes, our department really comes back to the faculty. And I've had, some of you in the room know I've had some opportunities to really do some deep dives into faculties and other departments over the past years, and actually probably over the larger, over our larger clinical enterprise. And I'm incredibly happy to be part of the orthopedic family, because we have a really good interactive family. People are honest about what's going on for the most part. They're honest about what they're doing. They're all doing it for the right reasons. They're pushing forward in the right way, and they work together better than most of the groups that I've been involved in recently in other institutions and other parts of the Duke family. So I'm very appreciative of the faculty here, and everything that happens in our department, every advance that we make happens because of the faculty. And my job is really just to provide the right environment for all of you to continue to do well. So in 2020, we're going to be 90 years old. So for those of you, the residents who are graduating, come back for our graduation celebration. And we're continuing to move forward, whether we can do it on land or sea. And I'm still waiting for someone to buy me an airplane. So next year we can also have a Duke airplane that we can use for that. So thanks for listening to our state of our department. I can open if we have a question or two. Otherwise, we can take a short break. Have any questions or comments? So let's take a short